You also want to set up your bank account and then set up your EFT with Medicare, and then also leave a week or two for Medicare to be able to make sure your clearinghouse is working and that the claims, you can send a test claim to see if that went through without any problems. So on to the patient portion. So you want to identify patients that you think may qualify for the STVAX, and these patients would be somebody that has failed 2 or more conservative therapies, meaning that it could be chiropractic, physical therapy, occupational therapy, multiple medical failures, whether it be pharmaceutical or injections or ablations or different medical interventions. It could be surgeries. It's also helpful to have one of the things that we do with our patients is we have them fill out their initial paperwork, their intake paperwork, and they fill out their records request before their appointments. So we try to do that at least a week or two ahead of their appointments, or you can have the patient themselves pick up their records. And what we're particularly looking for is anything within the treatments of the last year. Part of the LCD for Medicare is that they've had to have conservative treatment in the last 30 days. And we're usually looking for 2 of those failures. So whether those are chiropractic and physical therapy, chiropractic and injections, physical therapy and injections, whatever it happens to be, that's ideally what we're looking for. Or they've had some extreme failures with medical care recently. The other thing that we want is we want to get records of x-rays, MRIs, CAT scans, any other special testing that they may have that may add to the documentation of the situation so that you can justify the STVAX. And so what our team does is they send the records request, and so that we have enough time to be able to have that back before we see the patient, so we can build the file so the medical provider can review the file and have that documentation. As I said before, you can have the pick up their own